The 2019 novel coronavirus, otherwise known as COVID-19, is a pandemic of a respiratory disease that can spread from person to person and poses a serious public health risk. Because this virus is new and there is currently no vaccine to prevent COVID-19, it is important to understand how it spreads and how to engage in preventative practices so that yourself and others can remain safe and healthy. Health experts continue to study the spread of COVID-19. Currently, it is known to spread from person to person by being in close contact with one another, more specifically within about 6 feet of each other, and respiratory droplets produced when an infected person coughs, sneezes, or talks, or from touching a surface or object that has the virus on it and then touching your mouth, nose, or possibly eyes. However, this is not thought to be the main way that the virus spreads. Some recent studies have also suggested that COVID-19 may be spread by people who are not even showing symptoms, so even if you feel fine, you could still be a carrier for the virus. Now that you know how COVID-19 spreads, the next step is to take action by participating in preventative practices. Because there is currently no vaccine for the virus, some preventative practices that will keep us safe are avoiding exposure, which you can do by practicing social distancing or avoiding close contact with people, such as staying 6 feet away. Washing your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. You may also use hand sanitizer that contains at least 60% alcohol, which serves as a great backup if water and soap is unavailable. Avoid touching your eyes, nose, and mouth with unwashed hands. This will help prevent the spread of the virus into your body. Finally, stay informed by following advice given by your healthcare provider, your national and local public health authority, and your employer. This can allow you to gain new knowledge and know how to protect yourself and others from COVID-19. So, what do you do if you think you have the COVID-19 virus? If you're experiencing a fever, coughing, and having difficulty breathing, call your healthcare provider in advance and follow the directions of your local health authority. Calling in advance allows your healthcare provider to quickly direct you to the right healthcare facility, thus helping to protect you and prevent the spread of viruses and other infections. Stay home. If you're sick, it's best to stay home except for when seeking medical care. Now let's talk about what steps you can take to help protect others. Step 1. Follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately and wash your hands with soap and water. Step 2. Know when to properly use face masks. The CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as grocery stores and pharmacies, especially in areas of significant community-based transmission. The voluntary use of simple cloth face coverings can be helpful in slowing the spread of the virus and may help people who have the virus and do not know it keep from transmitting it to others. If you are sick, you should wear a face mask when you are around other people and before you enter a healthcare provider's office. If you are not able to wear a face mask, then you should do your best to cover your coughs and sneezes, and people who are caring for you should wear a face mask if they enter the room. And lastly, step 3. Practice regular cleansing. It is crucial to clean and disinfect frequently touched surfaces daily, including tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them using detergent or soap and water prior to disinfection. As the COVID-19 pandemic continues to challenge our community, IHC has built an easy-to-navigate listing of newly developed and publicly available local, state, and federal resources to serve our hospitals, providers, and communities in Iowa. To access our COVID-19 resource page, please visit our site at www.ihconline.org/coronavirus.